Hi everyone, this is Dr. Sterling Carter with Sterling Physical Therapy and Wellness, and today we're going to talk about most common knee injuries, the most common knee injuries that you typically see just in general. So this is the actual knee joint, and what we're going to do is we'll talk about a little bit of the anatomy of the knee. This is your right knee, and what we have here is the thigh bone or the femur bone. This is your lower leg bone, the tibia, and the fibula. And so these bones actually can be fractured. So fractures is one of a primary issue that can happen with a knee injury. Depending on the level of the fracture, you can actually have surgery or you can have rehab and just take time, allow it to heal, and just recover that way. The other issues that we typically deal with is ligament sprain, strains, or tears. A sprain is when the ligament, which this is the ligament right here, is stretched. A strain is when it's actually slightly torn, or a full thickness or complete tear is when this ligament is completely torn in half. So there are 4 ligaments in the knee. This one on this side is known as the medial ligament or the medial collateral ligament. On the other side is the lateral collateral ligament. All the way back here in the back is the posterior collateral ligament, and then deep inside is the anterior cruciate ligament. So if the knee is twisted to the outside or to the inside, it can put additional stresses on this ligament. If you've been too far forward, too far back, you can actually stretch, sprain, strain, or tear those ligaments, and we need to fix those. Okay. The other issue that we also deal with the knees are meniscal tears, which this blue disc right here, it actually gives you a little bit of cushion between your 2 major joints. This is known as the meniscus. This is a menisci, this is the medial meniscus, and this is the lateral meniscus. And what can happen is with blunt force trauma sports, you can actually tear these menisci, and it could actually end up with, you'll have pain and your knee catches, it gets stuck. And so what things that we can do for that is a surgeon can go in and actually trim this down, and then they'll send you to physical therapy, and we'll actually work on strengthening up your muscles, rebuilding the stability and the structure of the knee so you no longer have pain. One of the other major issues that we deal with is what's known as runner's knee or overuse syndrome. So a common one is dealing with this area right here. This is your kneecap, your patella. Below the patella, this is known as the patellar tendon, and this part of the tendon is your quadriceps tendon that runs up into your quad muscle. But what happens is if we run a lot, if we do a lot of bending activities, it can cause an overuse or a stress, what we call a tendonitis, to this area here. And that's a common thing, a common issue that can be fixed really, really easily with physical therapy. So that's the anatomy of the knee. This is kind of part 1 of a 2-part series. The next time we'll actually go through the exercises that will work perfectly to actually fix a lot of these problems and issues that you can have with your knee. I'm Dr. Sterling Carter with Sterling Physical Therapy and Wellness. You can find us online at sterlingtherapy.com or give us a call at 281-240-3140. Thank you.